My name is Mitchell Hardenbrook. I am the director of of my group, the Boston Spine and Scoliosis. I am a spine surgeon. I do a lot of surgery, both minimally invasively as well as reconstruction and scoliosis. I would summarize my experience with Catalyst as being very user-friendly. It is easy to open on the back table. It's easy to handle. It's very versatile. I'm able to place it either with my fingers or with pickups to the place I need it to be, or use a funnel and put it in a more tighter spot like an interbody device or interbody environment. So I think I find it very easy to use, and I find it very versatile in many different types of aspects. So the resultant catalyst that really impresses me is really twofold. At the time of the use, intraoperatively, it shows up very clearly on the fluoroscopy. And so I'm able to really be certain that, particularly in a lumbar spine, really complex scoliosis, I can actually see where I put the catalyst and that it's still there even after I've closed and get final images. And it's very reassuring to know that, when you do all that preparation for fusion and you create that healthy bed and you want to put whatever it is you're trying to put there, in this case the catalyst, at that fusion bed, that it stays there. And then you can follow it in images going forward. And so you can really see it incorporating it. It's where you put it and it stays there, and you can go back to it in future images and see that it's actually doing what it's supposed to do. So I use Catalyst in a variety of cases. Because of its versatility and easily being visualized on fluoroscopy, I use it quite routinely on anterior cervical fusions. I think particularly when I use PEEK and you can really see that bone formation, I think it's very helpful. I also like to use it in more complex cases and revision cases, primarily because of the handling characteristics, the science behind it, really showing that the outcomes and the healing rates are quite good. Being able to utilize it in interbody fusions, because it flows very well through a funnel, but still maintains its shape and does provide some structure in addition to the interbodies that we would be using. I find that in those instances, Catalyst really performs quite well. So evaluating a product such as bone graft substitute and trying to determine, is this right for me? Obviously, first and foremost, it has to have the science. It has to heal. It has to work. Nothing else matters if it doesn't that. But one step below that of significance is handling characteristics. I've used products in the past that quite frankly, it stuck to your fingers, so it was very difficult to put it where you wanted to, and once you got it there, difficult to keep it there. Some of the other products I've used, you irrigate just a little bit and it washes away. And you feel like, well, if the bone graft isn't where it needs to be, then you're not going to get the outcomes that you need. And so really just feeling in my hands the characteristics of the handling, seeing the strong data, both in animals and in humans, I was actually very, very interested, and it led me to using the product. So I was talking to a colleague of mine, in fact, over dinner about 6 weeks ago, and the topic of Catalyst did come up. And we had a good conversation about sort of the bone graft material they had used and the bone graft material that I was using. And we had a very good conversation about where we feel deficiencies are in the products that we use, and where we think that, if we could make something the way we wanted it, what would we look to do? And we both concluded that, the Catalyst really sort of met all those criteria. They had the science, they had the human studies, they had the characteristics, the handling characteristics, the ability to visualize on fluoroscopic images, being able to follow the incorporation through the healing process. And so, in doing that, I think we really came to conclusions again. It's a good product, and I think he's using it now.